Hi, my name is Eric Davis, and in this video I'd like to talk about back injuries and proper body mechanics in relationship to healthcare, specifically nursing. For starters, let's talk about back injuries. Back injuries in nursing are more common than one may think. According to the National Institute of Occupational Safety and Health, more than 24% of all work-related injuries and illnesses involving missing days at work are due to back problems. In fact, healthcare workers have 4 to 5 times as many back overexertion injuries than any other type of worker. That'll be more than male personnel, sanitation workers, even construction workers or firefighters. There are a variety of causes at play when you talk about back injuries in nurses. Researchers tend to break those causes into two umbrella groups: organizational causes and individual causes. Organizational causes take into consideration the fact that nurses nowadays are much older and there are fewer of us. The patient's population is getting sicker. Both the patients and caregivers are heavier. Many facilities lack supportive equipment. Individual causes take into consideration the fact that factors such as age, genetics, being overweight or out of shape, having poor posture, poor body mechanics, being pregnant, or being under stress could put one at risk for a back injury. There are also traumatic events such as a slip or fall or a car accident. There are many ways of preventing back injuries at your workplace. Some of the most major ones are staying in shape. Nurses who maintain muscle strength, flexibility, and normal weight are less likely to get hurt. Wearing proper shoes. Prolonged standing and walking on hard floors puts stress on the back. Comfortable shoes are good shock absorbers that can help. If in pain, look for alternatives. Nursing is very diverse. If bedside nursing starts to put a lot of stress on your back, consider looking for a different job. Advocate for proper technology. Most healthcare facilities invest into patient lifting equipment. It is important for your place of work to be up to date and support you with proper equipment necessary to keep you safe. Teamwork. Always work together. When you don't have access to lifting equipment, never try to lift patients on your own, even if they seem to appear very light. Always ask for help. And the last one is usage of good body mechanics. This is the one that I would like to discuss in more detail. Body mechanics involves the coordinated effort of muscles, bones, and the nervous system to maintain balance, posture, and alignment during moving, transferring, and positioning patients. Proper body mechanics allows individuals to carry out activities without excessive use of energy and helps prevent injuries for patients and healthcare providers. There are a few key elements of body mechanics that are important to understand in regards to lifting. Body alignment is achieved by placing one body part in line with another body part in a vertical or horizontal line. Correct alignment contributes to body balance and decreases strain on musculoskeletal structures. Without this balance, the risk of falls and injuries increase. Center of gravity is the center of weight of an object or person. A lower center of gravity increases stability. This can be achieved by bending the knees and bringing the center of gravity closer to the base of support, keeping the back straight. A wide base of support is the foundation for stability. Base of support is achieved by placing feet a comfortable shoulder-width distance apart. When a vertical line falls from the center of gravity through the wide base of support, body balance is achieved. If the vertical line moves outside of the base of support, the body will lose balance. These, of course, are general theories regarding lifting. Human body is irregularly shaped, usually large, and its weight is distributed unequally. When caring for people in a healthcare facility, special considerations must be put into practice. Assess the environment. Assess the weight of the load before lifting and determine if assistance is required. Plan the move. Gather all supplies and clear the area of obstacles. Avoid stretching and twisting. This may place the line of gravity outside the base of support. Ensure proper body stance. Keep stance shoulder width apart. Tighten abdominal, gluteal, and leg muscles in anticipation of the move. Stand up straight and protect the back and provide balance. Face direction of the movement. This prevents abdominal twisting of the spine. Avoid lifting. Turning, rolling, pivoting, and leverage requires less work than lifting. Do not lift if possible. Use mechanical lifts as required. Encourage the patient to help you as much as possible. Work at waist level. Keep all work at waist level to avoid stooping. Raise the height of the bed or object if possible. Do not bend at the waist. Reduce friction between surfaces. This way, less force is required to move the patient. Bend the knees. It maintains your center of gravity and lets the strong muscles of your legs do the lifting. Push the object rather than pull it and maintain continuous movement. It is easier to push an object than to pull it. Less energy is required to keep an object moving than it is to stop and start it. Use assistive devices. Use gait belts, slider boards, mechanical lifts as required to position patients and transfer them from one surface to another. Last but not least, work with others. The person with the heaviest load should coordinate all the effort of the others involved in the handling technique. It is far easier to prevent injuries than it is to fix them after they occur. It is the responsibility of the employer to provide a safe, work-friendly environment, but also it is the responsibility of employees to use good body mechanics and maintain healthy lifestyle habits to prevent injury. Remember, it is much better to prevent injury than to try to repair what has been injured.